Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So, welcome to the Healers Café. And today my guest is Reed Davis. So let me tell you a little bit about him. He's a board-certified holistic health practitioner and certified nutritional therapist, is an expert in functional lab testing and holistic lifestyle medicine. And he is the founder of Functional Diagnostic Nutrition and the FDN certification course with over 3,000 graduates in 50 countries. So I'm going to leave it at that and ask you, well, first of all, welcome you to this podcast. And
thank you so much.
Yeah, and so I'm going to ask you this question, and you can go on in any direction afterwards, but what brought you into this healing space? What was your story that first made you realize that you need to look into nutrition, or why nutrition? What's your story?
Well, thank you. Yeah, appreciate being here. I know you have a fantastic audience of practitioners and people who are seeking, and I've been a seeker my whole life. And actually, back in the 90s, I was in the environmental law field. That was my postgraduate work. And I was saving the planet, air, birds, water, trees, bees. Dr. M, I mean, I was really doing some good work out there in the world. And at the same time, noticing how bad the environment was for all of these things, noticing things dying as I'm trying to save the planet. And again, mostly animals and the air and the water and the land and things. I started wondering, what's it doing to people, including me? You know, I really wanted to be in control of my own health and destiny, and didn't want anything sneaking up on me. Like, you know, that's kind of how chronic degenerative disease is. It sneaks up on you. So I changed gears and changed jobs, and I had a little interim thing, but with corporate wellness. But I went in 1999 to a wellness center, and I was hired to run their business. Um, and This is really interesting because it's a wellness center. It's a mixed body of physicians and therapists and practitioners, and it was a neat place. And the owner said she was going to get her diplomat in nutrition, and I could go along with her and work on her patients between my classes. Now, who wouldn't jump at that opportunity? And I did. And so it was amazing. That's when I fell in love with the clinical side, working one-on-one with, you know, Mrs. Smith and Mr. Jones on their health problems. But the thing that bothered me the most at the time, and what I noticed that I just really got me into, you know, dedicated, was that almost everybody had seen multiple practitioners. Some had seen 5, 10 or more, and they weren't well yet. And, you know, I just thought, that's a ripoff. I just thought, you know, I didn't really have my own particular health problem at the time, and nothing I knew about. But I was really determined, kind of from that consumer advocacy point of view, that I would do something about it. And I determined then that I would be the last person they needed to see. And I was a very good researcher and writer, and I knew I could figure some things out. Not being a physician at first seemed like it was a bit of a nemesis, you know, like, well, how are you going to do that, Reed? You're not a doctor. That turned out to be the best thing, because even as one physician back then told me, one of my mentors, Reed, you know, it's a good thing you can't get out a prescription pad. You're going to have to figure out what's really wrong and teach them how to fix it. And I thought, yeah, no problem. That's can't be that hard. So, you know, fast forwarding a little bit, I got into running labs. I ran thousands of labs on thousands of people. These were at the time considered alternative, not mainstream at all. And yet I had really good mentors, some kind of pioneers. But based on my sheer experience, like, no one was running that many labs, Dr. M. And so obviously I made my own observations about who got better and who didn't. And I'll just wrap it up by saying that, it's no surprise to anyone listening. I'm sure that the these labs would identify underlying conditions and what I call healing opportunities,
Mm,
within the hormones, immune system, digestion. I ran every lab you could run, thousands of them. We had a robust practice, and I was good at building the business too. But I identified these areas that are very common in every health condition. Again, not being a doctor, not being able to or even wanting to diagnose, just wanting to know what's really wrong. I recognize patterns, and it's no surprise that those working at the underlying causal level got better. But what's not so intuitive, I'll just sort of leave it here, is that those with the exact same presentation or set of symptoms, or even clusters of symptoms, when you went far enough upstream, had completely different causal factors. It's just really, really interesting. So that's where my pattern recognition and experience and just the sheer volume of work and kind of correlating all that data came in. So I came up with some patterns
mhm.
that just work, and that's what I teach now. So after 10 years of thousands of labs and thousands of people, I did come up with a pretty cool methodology.
Very cool. So what, when you say labs, what are you referring to? Can you kind of expand on that?
Saliva, sure. Saliva
Saliva.
testing.
Okay.
Back then now it's very commonplace,
Yeah.
and there's dozens and dozens of lab companies. Back then there was only a couple. So, but saliva testing, especially with the hormones, cortisol, DHEA, and all the sex hormones and melatonin, things like that. Then of course the immune system, and then and we have urine testing for liver function and oxidative stress and digestion. So saliva, urine, stool testing, of course, for pathogens, but also now they've developed a very thorough assessments of the microbiome.
Mhm.
It's not always just look for a bug to kill. It's look for what's missing, what's out of balance. And so I stuck to this idea of balance and resiliency, just not diagnosing and treating, but creating balance, finding out what the healing opportunities were, and then giving people lifestyle recommendations. I did become a nutritionist, holistic health practitioner. I became a personal trainer. I'm trained in myofascial therapy and neuromuscular technique. I got a lot of training, but have put it together into mostly a system of assessments using the labs, again, saliva, urine, blood, and stool,
Mhm.
and then the protocols that include, of course, individualized diet and rest and exercise and stress reduction.
Mhm.
You've probably heard that word stress before.
Mhm.
And then supplementation.
Right.
And I don't have my own brand. I haven't gone there. I know a lot about them, and that's what I've been doing for 20 years.
Wow. I mean, that is truly the root cause, right? Is finding out what's not functioning. And we're in such a society where we think the enemy's outside and it's attacking us. And yet we're not focusing on what we can do inside so that we're in balance, so that when these natural things come our way, we actually have all the internal resources, the beautiful working natural pharmacy within us that can take care of the job. Right. So anyway, no, it's
I agree. Oh,
yeah.
I agree wholeheartedly. And that natural pharmacy is a lot smarter than we are, like, so, because there's so much technology and information and
Yeah.
just all this stuff. But is there the wisdom to use it is I think what the missing ingredient, and what can the body do itself that we can simply nurture and support?
Yeah. It's funny. We have this health advocacy is a bit of my background as well. And when I interview people, I share different things because different things get triggered in me. But one thing I really want to share too is I actually have I was doing my master's in law, and I got quite involved with asbestosis, which was a diagnosis that was missing at the time. This
Mm-hmm.
is way back in Quebec, and where I was studying at the time. So I'm not from Quebec, but I was there then. And they were diagnosing people with tuberculosis because it was the closest respiratory disease that they could make sense. But here's the other thing, too, it was by the medical doctors that were hired on staff for the industry. And of course, a good way to avoid workman compensation is to diagnose with something that isn't related to the work injury.
Right.
So
Right.
I got very awakened to, it's the money trail, the power trail,
The bureaucracy.
yeah, exactly. Why we're not able to get to the root of the problems. Like the solutions have been around for a long time in different forms, in different ways. And I was, without putting you in a weird position completely, and you can say what you want and not say what you don't want, completely fine. But what is your feeling that why are these, for example, these tests that you're talking about that really give an insight on what's happening? Why isn't that absolutely part of the steps that we take?
That's such a common question. We get asked by our clients all the time. When we present the data that we find in these labs, and we're data miners, we look for, again, for not diagnosing or labeling for an immediate treatment that fits within a certain standard of care, but what's really wrong, no matter how far you have to go upstream. And it gets very complex. And when it's that complex, it that calls for something that's very unifying and simplifying. And so that's what you and I teach. That's the natural world that we live in. It needs to be unifying and simplifying, because you may never find the root cause. It doesn't mean, though, that you can't have an effect upon it.
Right.
When you have the general principles of healing and this understanding of the innate intelligence in cells and tissues and organs and systems. So that's our system. But the other system just doesn't work that way. It's the shortest way out of the office. It's whatever ails you, how can we get rid of the symptoms? And so it's very much based in an algorithm that's usually regulated or dictated even by insurance companies, not by physicians. So I know physicians are very frustrated with this, and they're trying to do some good in the world too. And they are, and they're just the most incredible people when it comes to emergent conditions, emergencies, and where heroic things are needed. If you get off a plane from West Africa and your temperature's 105, let's say, and your eyes are bleeding, you're not going to call your nutritionist. You're going to go for the best, heroic emergent care you can. So, but if you go to those that same system for health building, the solutions just aren't built into it. In fairness, it's not the physician's fault. They're bound by standard of care and by the rules made up by those who are paying the bill, which is the insurance companies. So again, there are algorithms. They may want to prescribe a certain product or agent, but it's not covered. Or the algorithm dictates, no, you have to try this cheaper stuff first and put them on that for a month. And then you can progress to the next level. And so that's the algorithm. It's dictated by mostly the interests of the insurance companies, which are profits for shareholders, and so there's that thing to kind of drive in that system. And I think the patient is left underserved by it,
Yeah.
So I'll go there with you if you want to talk about that parts of it. I enjoy it as much as anything else.
Well, no, I just think it's something that, given the advocacy part of your background, I and your experience, because it's, you've been in practice for a long time, you've trained so many people in this. I just can't help but that's the question that really comes to mind. Why? I was just reading, and I'm no expert in this, I just want to claim this entirely, but I was just reading this study on zinc levels and the impact that it has for, God forbid, I don't think I'm allowed to even use the word in my profession as a naturopathic doctor, because we're not allowed to talk about the current virus. We can talk about any virus under the planet, but we're not allowed to talk about the current virus or in relation to our immune system or to our ability to deal with it. So everything we need to say has to be approved by our boards, our licensing boards, and we have to follow whatever they're saying, even if they change their minds, even if all these things happen. So in essence, we have a gag order currently.
Mm.
This is not news. I mean, it might be news to people, because it's not always the same in the States. It's not always true, but certainly in Canada, it seems to be
Yeah.
an issue. But I came across the study that, and because I'm trying to understand this as much as everyone else, what's happening with this current virus, let's call it this way. And I saw this study in Spain that when they did a mega study, they found that the majority of the people who were hospitalized had well below the level of zinc that they should have. And I'm thinking, wow, now, gosh, if that's true, and even before we know for sure, given that zinc is really one of those things that we should have in our diet, and if we don't have it, then there's very cheap supplementation. What if that was used as preventative? When they're looking at solutions for the old age homes and all that, why aren't we giving vitamin D and zinc? And I, it's very hard for me to understand why we're not. And
Yes.
maybe you had insight there.
I have lots of similar thoughts about things, but I try to take the broadest view possible. And it's perfectly fine for anyone to talk about lowering one's risk for disease. And that's okay. You don't have to have a license, or if you have one, you don't have to be shy about talking about lowering our risk. Now, do minerals count towards lowering risk? Yes. Do other, nutrients count? Yes. Does protein, fat, and carbohydrates count? Yes. The ratios are very, very important. So, we're talking about diet mostly. Well, some of these things that would help lower risk by improving the immune system are really about balance. So, and our diets weak on zinc and other things that help the immune system? Yes, they are. And it's what you eat, but it's also where the food is grown and how it's grown and how it's cultivated, the whole thing. So there is just like I started in the area of nutrition and in the environment and saving the planet. People are part of it, and there's an ecology. So there's an ecology for the entire planet, and we're part of it. And boy, you could take this really deep if you wanted to. But we need all these. We don't just need zinc. We need everything in balance. The copper is important. You start naming minerals if you want, and the table of elements, although some of them are dangerous. And so you have macronutrients and micronutrients and phytonutrients and amino acids. You have the antioxidants. You have all of these things that need to be. They're part of the equation. And so I think that we run a risk sometimes when we point out one or two, that you're actually just commercializing it. And even that's not bad if you keep it a perspective on it. Do I take zinc before an airplane flight? Yes, I do. I take my echinacea, take my things that I can use to lower my risk of susceptibility, whatever someone on that plane has. Obviously we're not doing a lot of flying these days, but I did go to England and back in July. People thought it was crazy. I said, I could handle a little bit of this virus. I'm not at risk. I don't have any blood sugar problems or lung problems or immune system problems, or I'm certainly near approaching the age group where age is a factor, but I'm just in really good shape. So I wasn't afraid. And I don't know I'll throw out a tidbit for you that'll bring some relevancy. The average age of the death from COVID is 78. The average age of death from everything is 78. In other words, the average age of death in this country is 78. And so it just it's not really that big of a deal to me. I wouldn't want anyone to have. My mother's 90. I tell her, stay home, Mom. Don't go out there socializing too much. But for goodness sakes, I'm with you when it comes to being able to speak with common sense and a broad view of let's all reduce our immunity. You know who Jeffrey Bland is? Reduce our you know what I'm trying to say? Reduce our risk, lower the risk by improving immunity and every other system in the body. And Jeffrey Bland, who's considered by many as the father of functional medicine, he started talking this stuff in the 80s and wrote some of the very first books on what's now called functional medicine. And, you know, he said that in a Zoom meeting, I was in a Zoom meeting with about 50 people, and he spoke, he said, everyone's going to be exposed. So you can do, you know, you don't want to get exposed, but you're going to. So you might as well start working on lowering your risk. And that's the only way out of this thing, you know, because, and then we'll end up with herd immunity and we'll all be okay. Unless some other virus comes along.
Yeah. No, and it's surprising to me that it's not, and I agree, by the way, it's not like picking one element or another, but because that's, again, commodifying, oh, now zinc, and then you go take way too much zinc, that the body needs substrates of everything, but it knows how to balance it when you're in balance. So I did want to just agree with you on that point, because people tend to then go shopping like crazy and just take one thing and they think that's it. No, it's much more complex than that. So I totally agree with that. But I mean, there are studies now from hospitals where, you know, they isolated vitamin D as the difference that made a difference, and zinc in populations. And so, you know, I look at this, you know, is it because it can't be patented? Is this why we're not doing prevention? Why are we not at this point focused on prevention? I mean, we are kind of wash your hands, apparently social distance, masking, you know, which, I mean, I don't know if you've read all those studies, but I mean, there's as many for or against with the mask, and, you know, the bacteria in and re-inhaling, and there's so many things, like, and I'm not here to debate that. Again, that's not.
I'll tell you the answer to me.
Hi, it's Dr. Manon, and I just want to take a moment, commercial break, to ask you to subscribe to my podcast and kindly leave a comment if you're enjoying this. And also, just to let you know, I have tips for people in health looking for solutions to just a variety of issues. It's more like an attitude of health, and they're entertaining short videos, and you can find those under drmanonbolliger.com/tip. The link is here, and I look forward to hearing from you.
Again, taking the broadest view possible, is that there's just way too much money in disease management and care, you know, and patenting drugs and things. You know, in 1903, a very smart man who today, you look around your house, a lot of things were touched by this guy. His name is Thomas Edison. He's one of the greatest inventors of all times. 1903, he said, the doctor of the future will prescribe no medicine, but will interest his patients in care of the human frame, in diet, and in the cause and prevention of disease. And it's, you know, it's a great inventor, wonderful person he was wrong about that, because the doctor of the future is the ones practicing today. Obviously, it's 100 and some years later, and 55% of all Americans are on at least one medication. In a study group, the study group asked their practitioners, can I get off some of this medication? 71% were told, yes, you can get off some of it. You don't really need it. And in 2018, in this country alone, 415 billion prescriptions were filled. I was written a couple. I tossed them. I didn't take that stuff. Mostly for pain for injuries. I don't take pain meds. But anyway, so 415 billion prescriptions were filled. And last year, the amount of money spent on medicine, drugs, was $520 billion. That's $500 billion on drugs. And so I'm sorry, Mr. Edison, you know, the doctor of the future's doing plenty of prescription writing. And because it's just so lucrative. I can go on and on. I have the statistics. I've done the studies. It's something that I learned to do when I was getting my law training. I never became a lawyer. I want to say that for lawyers. I became a paralegal. It was just, I just had to get out of school and get to work, make a living. And I found a very good way to do that. But, you know, I did learn how to hit the books. And I want to tell you, there's just so many statistics that would back me up, that there's just billions and billions and billions of dollars in sickness.
Yeah.
If everyone was well, it'd put a lot of people out of work. So there are those are sort of the forces, if you will. These people also are very much into monopolies. In 1960, we spent about $90 per person in the U.S. on drugs. Now we spend over 1,000. So that's a tenfold increase in the amount each person spends on drugs. There's a reason for that. There's something driving that, and it's the money. It's not. I mean, look, when they allowed advertising for drugs on TV, which was always prohibited until the last couple of decades, it was forbidden. You couldn't advertise to the public this stuff, not the prescription.
Right.
So now you have the tail wagging the dog. You got people going telling their doctors what kind of medicine they want to try. I think that's pretty.
Yeah.
It's all just driven by what I said, and they want monopolies. There's actually you know, not that many drug companies, maybe 100 top companies, but what the big ones do is buy up the little ones. They consolidate, they take over, they buy them up. So, you know, that, and again, these smaller drug startups, that's their entire purpose. They want to invent a drug that's going to hit the market, and they cash their chips in, and the big companies just keep selling us drugs.
So what do you think? I mean, because the proof is there, the evidence is there. This stuff works when you look after your health, and you can really have a body that works, and you can prevent many of the preventable diseases that we know, whether it's diabetes, I mean, arthritis, so many things that I know patients would come to me and they say, well, oh no, my doctor told me there was nothing I can do. And it's like, well, that's, you know, here's the proof, but let's do it and see if you change. And then they would notice that, as, you know, taking naturopathic medicine, looking at nutrition, different aspects, including also body work, right? Like you said before, myofascial, there's so many ways that we can help a person regain their vitality and their health. So individually, people who have opted in for this are usually the people who are at the end of the rope. The drugs are literally killing them. They can't stand it anymore. They have too many side effects. But how do we change it so that people from the start realize how amazing our bodies are? What do you see happening so that this changes? And what are we up against?
Well, we just talked about what we're up against, and that's just the drug companies. Now, you could go then to, you know, big agri and the way food is, you know,
Monsanto
raised and distributed in the country and things. So there's lots of, again, I think it's the desire for monopolies in terms of what's driving advertising and kind of controlling the population. I don't want to go too much off into any theories, but I'll just say that, you know, one person can make a difference, and that we each need to take responsibility and start with ourselves and walk the talk. And so then, as we're setting examples for others, people will say, hey, you know, how come Reed never gets sick? You know, why does Reed live this lifestyle that's so incredible? I'm really a fortunate person, but I've also worked really, really, really hard, you know, so I feel like I've kind of earned it, but I'm thankful and grateful every day and humbled, you know. And so what I did when I noticed this back in the day was start studying and learning and what can I do. And remember, I said my motivation was that I didn't want anything sneaking up on me. I wanted to be in control of my own destiny. We just learned, quite frankly, that someone else will control it if we don't demand we maintain that control.
Right.
They will control you. They being the powers, the people who are fighting for power right now, and they're in cahoots with the big people who want monopolies in businesses, large businesses. And so they're funded by them and stuff. And so they want to control of your health. They want control of your business. They want control of your finances and your happiness. You might as well just, you know, believe it, in my opinion. And so it takes each of us to take that responsibility, self-awareness, and work on yourself, be an example for others. And what I've done is I started teaching in 2008, and I just had a class of 19 people for a 2-day webinar workshop. It was a workshop, not webinar, but live workshop. And it was international from day one. I had two people fly over from England, one flew down from Canada. They'd heard about me through a group that I'm in, and I taught. And I've been teaching ever since. We've grown to thousands of people around the world, and I'm deputizing them. And I'm now expanding that, and this takes time. I work with what resources I'm not financed by big pharma, big agri, or big anybody, just me.
Right.
And, so I've had to be an entrepreneur and struggle kind of tooth and nail, but I also have a very, very cool product, if you want to call it that. And I teach and I deputize others to go do this good work. So that's what I'm doing. But I'm also, just to answer your question, Dr. M, just yesterday I met with someone else who kind of does the same thing. And I said, let's band together. Let's start these advisory boards and discussion groups and public access. And let's find a way to get it to the people where it's not so expensive.
Yeah. Because
frankly, to hire one of my practitioners, and you can go to fdnthrive.com and see what that's like. We have to, we're independent business people, so we have to charge a lot. But there's a way that it could be institutionalized once we get some groundswell.
Yeah. Well, we're very much on the same page, because that's part of the podcast is seeing who also is there to collaborate with. How can we do a certain part that is everybody to help to get the message out? And then there's individual one-on-one, more deep dive into a person's direct physiology or what's going on in their life or lifestyle. But I think there's a lot of information that can be shared in less expensive, in that sense, platforms that can reach more people. So we definitely need to talk, because I'm all for that. And I think it's so important. And we've been focusing on nutrition because that's your background, but there is equally as much on understanding stress, on understanding your mind and your mindset, and what fear does to your physiology, and all of those other components that affect our physical bodies. And a lot of people don't know this, and they don't realize that if they're going to be glued to the news, they're actually having impact. And it doesn't matter what party you're for. In Canada, we don't have the same people. It doesn't matter, right? It's if you're glued to fear and to lack of empowerment, to lack of self-responsibility, you're always going to be a victim to whatever is stronger out there, that whatever forces are out there.
Yeah, absolutely. I mean, I didn't mention it, but I'm actually Canadian. I've been I've been in the States since I was a teenager, and I never really cared who the president was. I just kept my nose to the grindstone and did stuff. And so, and I remember the politics of Canada too. I was back in the Diefenbaker days, and these, so long time ago. But I never cared, pretty much. I've done hard work and just, I keep my nose clean and I pay my taxes, whatever, So nowadays it's really making me think, there are some real differences and changes coming about if we don't watch out. But but so I didn't really put much sway in that, and it just worked hard. And like you said, it's not just about nutrition. And yes, I studied nutrition a lot, but I studied more stress. In 2001, I read an article that stress caused 50% of all disease, and the 70 to 80% of all doctors' visits were stress related. So, and it's the perfect area for a non-physician to work in, because now I have a way of assessing people and what is stressing. So, and I'm also, remember, I'm a sort of that organizer, pattern recognizer. I like creating systems for assessment, and you go through the steps, and then systems for application of the healing principles on a human. And so we apply those in certain steps and things. And so with stress, you could break it down into three major categories. There's the environmental stuff, what's the chemicals and the biochemical, the chemistry of your own body, can kill you. So there's the chemical, biochemical stuff. I'm so glad you mentioned the physiological trauma, and that's probably my number one complaint, is because I have a very well used body. I've been motorcycle riding my whole life. I've surfed. I wrestled jiu-jitsu till I was in my 60s. Wow. And played football and all kinds of things. So I have old injuries. Those add up. They're stressful to the body. They cut off energy flow and circulation and nerve flow and things too. So on top of that, all that chemical, biochemical from the world environment, our food and drinks, and then you have all that built up trauma in your body, even just weaknesses and repetitive motion and micro traumas and stuff. But then you also have, what I'm so glad you mentioned, was this existential angst, lack of purpose in life, no point of view that's very good, and just regular mental emotional stress of hating your job or focusing too much on politics.
Yeah.
So lots of different types of stress, and it will put you in the hospital. Yeah. If you don't have ways of dealing with it, mitigating, and actually finding joy.
Yeah. No, exactly. And it's, to get there, you have to do the work internally. At least that's what I found. The external circumstances will never justify, now it's time to be joyful, or now it's time to be happy. It doesn't really work that way.
Do you have a favorite way of doing that, Dr. M?
Me, it's nature. I live by the ocean, so I like to have steps, like walk outside on the sand. I like to swim, even when it gets really cold. I'm okay with that. It's a question of training your body to be okay with hydrotherapy, and kayaking, and listening to the wildlife that is around, and like my daughter says, hugging a tree. To me, nature and the sound of waves, and that really.
I just changed, just since you mentioned it, I just changed my background picture to my backyard. So I literally live in the mountains on that lake right there, and that's my pool. Yeah. So I feel you on the water. I put my feet in the sand, or pardon me, on the rocks just about every day, and now I can't figure out how to turn that off, but and sort of go back. But yeah, so I'm just tickled to be speaking to someone of the same ilk.
Yeah, but I think it's interesting how it's there. Nature is around, and it's something we can do. Just learn to breathe with it. I know when I decided to so-called retire, I knew I would never retire, that I would retire from my 30 years of practice. I told my partner, I said, well, where I live is going to matter to me, because I'm never going to stop working, because I love what I do. I'm passionate about what I can see, and how I could, participate in making this world a saner place. At least that right now, that seems to be the biggest thing. And it's funny because he noticed that my breathing changed when I got to the ocean. And I had my practice first in Nova Scotia, which is the complete other coast in Canada. So I went literally across across Canada to I'm on a little island called Bowen Island.
Oh boy, that's funny because you practice the Bowen technique.
Yes, I know. There are
That's
no coincidences in life.
yeah. Well, I know we're winding down, Doc, but I just want to say it's a pleasure, and I hope the listeners feel inspired, somewhat better, like a little bit uplifted, because while we did talk about some of the darker things that are extant in today's world, you know, it's still up to the individual.
Yes.
And what you said is so right, and it starts with your breath and putting your feet on the in the earth, and remembering kind of where we came from, that we are born with innate intelligence in our cells and tissues and organs and systems, and we can nurture that. And if you're nurturing that, it includes your mind and spirit, and we can do better. We can do better. We can make it a better planet. And
Absolutely.
whether you're recycling, your aluminum, or you're taking care of your skin and your body, and whatever, it just a million different ways we can do better. We can do good. We can help others.
Well, thank you very much, Rue, and we'll put links so people can get hold of you, and whether you're a practitioner or the public. And so, anyway, thanks very much for participating in this.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.